Oh man, that hurts. Does that sound like you when you're trying to reach up in the cabinet in the kitchen? Or maybe when you try to put on a jacket or probably wash your face? If that sounds like you and your shoulder hurts during activities like that, you're not alone. Painful shoulders affect millions of people every single year. But how do you know what the pain is coming from? Well, stick around. I'm going to teach you if your shoulder pain is coming from a frozen shoulder or something else. In this video, you're going to learn exactly how to get rid of your pain. Now, I watched a bunch of other videos on frozen shoulder, adhesive capsulitis, and they are fantastic at explaining what frozen shoulder is, how you develop it, what types of treatments you need to do, blah, 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 blah. You guys don't care about all that stuff. I know you don't. You just want to get rid of the pain and get back to your life. And this is the only video you're going to need. All right, guys, so I'm going to teach you what a frozen shoulder looks like so you can identify this by yourself at home. Here I have a goniometer. This is what we use in the clinic to measure the angles of the joints. All right, so you'll get to see what a frozen shoulder looks like versus what adhesive capsulitis looks like versus what a rotator cuff tendinitis looks like. All right, so here we have a normal shoulder, right? This will go up to 180 degrees, all right? If you come down, we're going to place the goniometer right at the shoulder joint. That arm drops through the midline of the trunk, and this arm lines up with the humerus, right? So here's 90 degrees, right? A frozen shoulder will start to get stiff around 120 degrees, or maybe it goes up to 140, or even in fact 150, but right around there will be the limit of which a frozen shoulder will move up to, or the beginnings of a stiff joint. And if that shoulder isn't dealt with, the range of motion will get less and less over time, and the pain will start to build and go higher and higher, and this will turn into adhesive capsulitis. You do not want this to happen because this is what adhesive capsulitis will look like. So you're down here at 0 degrees. Adhesive capsulitis stops there, right around 60, maybe even 50, between 50 and 60 degrees. Some can get up to about 70 degrees, but if you've ever seen someone do this when they're trying to raise their arm and they just can't, that's adhesive capsulitis. And trust me, guys, you don't ever want your painful, stiff shoulder turning into that. All right, so now let's say, but Dr. Rob, I can raise my arm all the way up, it just hurts. All right, so if it looks like this, right, we start at 0 and we go up to here. Now the pain starts here at 90 degrees. It keeps getting painful, keeps getting painful. Now it goes away at 120, 130, and you can go all the way up. That's rotator cuff tendinitis. You've just identified the painful arc of motion, and that's what we talk about here in the clinic when we see tendinitis in the shoulder. And the way to rehab that is, and the goal would be to shrink the painful arc. All right, so we'll go over this again. Here's adhesive capsulitis. You're stuck down in here. You can't go any higher. Frozen shoulder, you get stuck around here, right? And then a tendinitis or rotator cuff tendinitis starts to get painful there. The pain continues and then disappears, and you can move through the full range. So these types of shoulder problems are treated much differently. All right, so the frozen shoulder is when the capsule starts to adhere to itself, but adhesions haven't been formed yet, right? So the geniuses who've named these types of problems really got scientific, right? So frozen shoulder, so just think stiff shoulder. But adhesive capsulitis, right, the capsule of the shoulder, which is the piece of tissue that surrounds every joint in our bodies starts to adhere to itself and to the bone, and you develop scar tissue. That's why you cannot move the arm up above that 40 or 50 degrees. All right, so now we are going to teach you how to get rid of it. All right, guys, so here are the only few exercises you're going to need to solve your frozen shoulder. You find yourself a doorway. Everybody's got one at home, all right? You're going to get your arm from elbow to wrist on the door frame. You're facing the door frame, okay? The exercise looks simply just like this. You're just going to turn your feet until you feel a tightness, a stretch in your shoulder, then you're going to stop and hold it, right? So the arm is comfortable here, and as you move into external rotation, you're going to feel a stiffness. That's where you hold it. You can hold it 5 seconds, 10 seconds, 15 seconds, 30 seconds. Remember, this is a long journey, not a sprint, all right? So ease into this. Start low and work yourself up high. Start easing into the pain, all right? So right there, it might feel a little bit of pain, a little bit of stiffness. Start with that. Do that for a couple days. Gently ease your way into it. You're not going to do this on day one. If you do that, you're going to cause a flare-up. So the first thing you want to do is control pain, all right? Use heat. Use over-the-counter anti-inflammatories. You must control the pain, because the reason you're in this mess is because your brain did not want your body to feel pain. The only way out is to cause pain. So you have to do it very slowly and methodically. Get on the door frame, turn your feet, the arm doesn't move, and your goal would be to get to here. Full external rotation. The only two motions that you care about in the beginning with a frozen shoulder is external rotation and then flexion. So here's what flexion looks like. Just run your arm up the door frame. Stop where it starts to get tight and painful. Eventually you want to be here. Once you get here, then you want to lean into the door frame. This is where people go wrong. They don't add the leaning in, all right? And you could potentially solve your frozen shoulder in the matter of days to weeks if you catch it early and you get aggressive early. You must be aggressive with these exercises, but you can't do it too soon. You have to use a bit of common sense here. So your goal would be to get to here, then you're going to lean into it, all right? And it's that leaning in that will really stretch the capsule, get you to that 180 degrees, and then your frozen shoulder is gone. If it's adhesive capsulitis, you're not going to be able to do these, so let me take you over to the bed and show you a much gentler way to work with adhesive capsulitis. All right, guys, so we're going to assume for 1 minute that you're not an Art of Recovery subscriber, and if you're not, hit the subscribe button, because you didn't want to miss this video and had your frozen shoulder turn into adhesive capsulitis. But just for argument's sake, let me assume that you're not subscribers and you're watching this for the first time. Your frozen shoulder turned into adhesive capsulitis because you didn't get it quick enough and you didn't watch this video. So these are the exercises you're going to want to do. They're much gentler than what we just went over. You need to find yourself a wiffle ball bat. This is a weighted baton, a broomstick handle, an umbrella, something to that effect. You're going to lay on the floor, all right? You get comfortable. The whatever you're using, the weighted baton, is going to go in your hand, palm facing you on the affected side. The other palm faces away. This is the driver. This is what's going to stretch the affected limb. You move your arm slightly away from your body and turn on this angle here. Then you're just going to gently push the arm into external rotation. All right, so you adhesive capsulitis guys, you're going to look like this. It's going to be real stiff. all right? So you're going to hold it wherever it starts to feel tight, okay? And then you hold it 5 seconds, 10 seconds, working up to 30 seconds, just like that. Eventually, you'll get it to around here, and then flexion looks like this, straight back, all right? But the adhesive capsulitis people will be here in this range, all right? You're slowly inching back over the weeks and months. Yes, months, it could even be years when your adhesions start to break up. It takes a long time, so we urge you not to allow it to turn that bad. Get it early. Watch this video, save this video, send it to a friend. This is very important. You do not want adhesive capsulitis. It is very, very painful in the rehab process, okay? It's a journey, not a sprint, and make sure that you ease into the stretching protocols. Flexion and external rotation are the only motions you care about. Internal rotation, which is reaching behind your back, will come later once those two start to loosen up, but you can use the stick by reaching behind you like this and pulling the arm across you like that, all right? But all you need to do is worry about the first two first. These can take 6 months, 12 months, up to 24 months to get better. So, you know, just work hard at it and separate yourselves from everyone else. Do these exercises every 1 hour to 2 hours to speed the process up. That's what separates Spectrum Therapeutics from everyone else. You'll normally hear do this, you know, 3 times a day, twice a day, 4 or 5 times a day. No. You want to do this every hour, every 2 hours at the minimum. All right, keep the arm moving. So what separates us here is that we get people moving early and often. So take care of your shoulders, guys. Make sure you subscribe, share this video, comment in the sections below on your experience, and we'll see you on the next one.